there are 11 million children just in the US that are acting as interpreters. And if you think about that, this is child labor, right? That we somehow are okay with, right?
Welcome, everyone. You've just joined BoostCast. I'm your host, Dieter Runge. BoostCast is a brand new podcast series with a global language-centric perspective. Today, our guest is Carol Velandia. Carol is the founder and CEO of Equal Access Language Services, LLC, which is a language services company based in Baltimore, Maryland, and a few other locations, I believe, as well. Dynamic language industry business leader, Carol is an extremely passionate and prolific advocate for language access, language rights, and language justice. Carol is also the founder of and driving force behind the multifaceted language equity organization Unheard Voices, and I will definitely be diving into all about what that's about a bit later. But well, first things first, Carol, thank you so much for joining us here today at BoostCast. Thank you.
Thank you for inviting me, Dieter. This is an honor and a pleasure to share with you this time.
Well, I got to be honest, when we decided to look at who's who focused in the areas of language access and language equity, I can't tell a lie. You were the very first person I thought of. So I'm delighted that we found time to finally connect, because I happen to know for a fact that you've been really busy traveling quite a bit lately. I think you were over in Europe for a little while, or...
I was in Europe, and in fact, you mentioned that my company is based in Baltimore and a few other locations. And yes, I want to make the leap to Europe, as I realize that language access is not only a US problem, right? It's potentially a worldwide problem, as we have lots of immigration and globalization. So I was traveling, and besides having a lot of fun, I was also paying attention to that.
Doing a little bit of due diligence and doing a little reconnaissance mission overseas. Yeah, well, I can't disagree with that. But you know what I'd like to do maybe is start things off maybe with a little retrospective of your journey in the language industry, a little peek at looking back, maybe some detail on what inspired your passion for language equity and access, and how that shaped your career in the language industry.
Yes. Well, what inspired me was my work at one of the best hospitals in the United States. This was about 10 years ago, or even a little more. I had an unusual professional route as I started in the area of marketing, promoting the hospital's state-of-the-art discoveries, and caring options around the world. Then, due to my type of visa status and their decision to fuse my marketing division with their larger division, I became a medical interpreter. And at first, I thought this was kind of a setback, right? However, I met a patient that really changed my vision of my persona, my professional persona. And let's call this patient Jose. But I can tell you this is the story of many, many patients. His situation was very compelling to me. He fled his country because of gang violence and came to the US to save his life and ensure a better future for his family. Then he got sick, and that is why I met him. At his appointment, he told me that he had waited a couple of months for his appointment because there was no interpreter during his original appointment. So his appointment was canceled. Because of lack of knowledge about his language preferences, and because language access wasn't a well-known thing within the hospital, his health seriously deteriorated during the waiting time. It made me realize, when he told me this, it made me realize how important health is, right? It's really our most important asset. And the other thing that I realized is that effective communication and language access have a direct health impact on people who don't speak the dominant language. Thus, language access must be part of any hospital and any public service strategic planning. So I really would say that this is absolutely necessary, right? So this is what really inspired me. And I started to look into this issue. And I started to think that there is no true inclusion without language access. We talk a lot about inclusion, cultural competency, diversity, and all that, but we really forget that language access, not just language diversity, but language access, is a key part of inclusion. So that's how I created my company, Equal Access Language Services, with the vision of preventing language-based discrimination, as you said in the introduction, and help companies and organizations become accessible and socially responsible. I also think that as language services providers, we need to become experts on language access so that our clients can offer a more comprehensive service to their clients and they can enjoy the benefits of better outcomes across the board.
Yeah. Well, yeah, it's absolutely true. I mean, we always, when we look at, the healthcare space, it's impossible to attend to or treat the patient if you can't communicate with that patient, and if language services aren't available, it makes it uniquely challenging for physicians and help staff. So, how would you define language access and language equity? And I do agree that these are very different concepts, but also intertwined and important. But how do you define it, and what do you think are some of the more significant barriers to achieving it in the healthcare environment and beyond?
Well, I define language access as equal treatment, English or no English, basically, right? And language equity means recognizing and valuing linguistic diversity and not discriminating people simply because the language they speak. It's also about building those systems where language differences don't stop anyone from fully participating in society, which is really the aim of language access, making possible for people to participate in daily living, basically. We also have to think about this concept as a way of making sure that people from different national origins have the same opportunities and access to services, and more importantly, the opportunity to get the best possible outcome within their specific circumstances. What I mean by that is that people with limited English proficiency in the US, for example, experience worse outcomes in the major categories of public services: healthcare, justice, education, simply because they don't speak English. So these are the cultural and systemic obstacles, the barriers, right? And the major cultural obstacle that I think we need to fight is the thought that we have that in America we speak English. And though that's true, we do, but it's important to understand that we also speak over 400 languages, right?
Yeah.
And also that are spoken and signed. So we're not monolingual. We're not a monolingual country or a monolingual society. And we need to start recognizing that and bringing it into the collective consciousness in order to solve it. So another important cultural barrier is the idea that language access is expensive. You hear that that is always some kind of an excuse. But what it is expensive is the medical errors that cause medical waste and major wasteful spending. What it is costly is depriving someone of their freedom or education because of lack of language access. So investing on language access improves the outcomes for 9% of our population. Think about that. That's 26 million people. That's the size of the country of North Korea.
Yeah.
So those are some of the barriers and definitions that I want to put forth.
26 million, that's the size of Australia, too.
Really?
Yeah.
I did not know
Crazy
that.
as that may sound. Well, let's talk a little bit about some of the more effective policies or programs that you yourself have implemented, or maybe that you've encountered that has improved language access in underserved communities. And maybe if you could color that with some of the locations where you've been able to, and had some success doing that, that would be interesting to hear about.
Well, I love this question because it made me go in detail. Like researching for this question was interesting to find good examples of language policies that are already applied in the US. But Title Six of the Civil Rights Act, Title Six of the Civil Rights Act
Yeah.
of 1964 prohibits discrimination based on national origin, and this includes language, of course. And also, another very important law is Section 1557 of the Affordable Care Act, as it prohibits discrimination on the basis of race, color, national origin, sex, age, or disability in health programs and activities that receive federal funding. One of the key elements is ensuring that individuals with limited English proficiency have meaningful access to healthcare services. And I love the concept and underscoring the idea of meaningful services, right? Not just any type of solution works. It has to be meaningful. So that requires that covered entities covered by Title VI provide qualified interpreters and translation services at no cost to the patient. So this policy has been instrumental, right? Because it assures or it promotes that healthcare organizations provide this service, and it also gives some accountability. Now, I found a really beautiful example of this in New York City, and I'll say that it can operate as a model, right? There is a law called the Local Law 30 of 2017 that requires city agencies to translate essential public documents into the top non-English languages spoken in the city, as well as to provide interpretation services in any language upon request. So I went to their website and discovered that, first of all, they have, you can select the language right at the beginning, right? And then it tells people about the rights, on the language access rights, and it tells people who is the language access coordinator in each of the services that they need. So I thought this was terrific, and I hope to see more examples of that being implemented.
I've seen, you know, very recently, I think New Jersey did something similar too, and there's a few other states that have, um, mandated support for a longer list of languages. And let's be realistic. The top sort of 20 languages in any location have changed dramatically over the last 20 years, and they still continue to change, and we see that with migration from new regions globally, and the refugee and migrant uh, communities that are coming up in certain locations. I'm not always clear on why a particular area is selected as a region where a particular culture or language will start to grow. Um, but what I do know is that there are certain cities where there seems to be a deficit in support for that particular language, and I'm just curious. And I've seen things. I think Oregon just recently expanded their list. Um, where in the U.S. have you seen some of this uh, uh, evolution in the support for uh, new migrant languages and the sort of the uh, new growth languages that we're seeing in the U.S.?
Well, I love that question also because as part of my training, the training I developed, that's effective inclusion through language access, I discovered that our language diversity and sort of the way languages grow, if you will, here in the US have to do with a long history of land purchase, right?
Yeah,
We purchased Louisiana at some point, and we really have never been English only country, not ever,
that is
right?
a
So this
very
is
true
amazing
statement.
to know.
Exactly. Yeah.
And well, I haven't. I would say that I see a few more things with associated with helping people with of non-dominant languages get around. So, for example, I was recently in Boston, and I was surprised to hear the metro instructions also in Spanish.
Yeah.
So that is started to happen, and perhaps it has happened for a few years now in things like that. And that was something I observed in Europe. There is They acknowledge themselves as a multilingual community, and they have in many countries instructions on different languages for public transportation is what I experience
Yeah.
personally, right?
Well, you don't have to look too far, really. In the U, I mean, just go across the border to Canada, which has always, language and identity in Canada has always played a major role, with French, Canadian, and English being the two official languages. And many countries have, two or more official languages. I think Singapore has four official languages. And they do quite well, and the
And
support
yet we
is,
don't.
and yet we
We don't
don't.
have an official language in the US.
It's pretty crazy. I mean, we have ads on television that are in Spanish. It's part of the fabric, part of the mosaic of culture and language in the U.S. But it still seems to be a challenge in many locations. Carol, you've developed curriculum, which you've provided to both public and private organizations. How can you ensure that the language services are culturally competent, in addition to also being linguistically accurate in that space? What are the keys to success? What are the factors that contribute to ensuring that you have?
Yes, and before I jump into that question, I just want to point out that we don't have an official language because our founding fathers were more visionary than we are, right? So they realized that we were multilingual, and that we should keep it that way, basically. And that's how we need to acknowledge first
Yeah,
that we are multilingual. And that's the first step to making sure that we offer culturally competent services, right? Sort
it's
of
it's
putting,
actually amazing how prescient the U.S. Constitution is.
yeah,
So, very, very good point.
yeah. So I think that we need to think about cultural competency as something that we're part of, meaning we're not providing like sort of merciful services or some kind of like I don't know how to express it, but we are part we're on equal footing, if you will. So the first thing is to work with professional culturally aware linguists, right? It is important to hire professional interpreters and translators who not only interpret but also truly understand the cultural nuances, traditions, values that the community they serve has. So, and then that they also abide by a code of ethics. I think one of the key differences between working with a bilingual person that has not been trained as interpreter, and this is a solution that many institutions have as part of their language access plan or not plan or lack of plan. The main difference is that interpreters, for example, and translators have a code of ethics, right? And that's what makes the difference. So if you hire a bilingual personnel to
Yeah,
serve as interpreter, train them, right? Being
100%.
bilingual does
Yeah,
not make a person interpreter the same way that having hands doesn't make a
that's exactly
pianist, right?
right.
I love that saying.
Well, I was going to say that, and we focus a lot, on healthcare and legal settings when we talk about, you know, language access, but there are also other sectors where language inequities are equally urgent and pressing, but I would say underexplored. Have you found that there are other of sectors of industry, other areas where, beyond just, healthcare setting, certain areas of community settings, where certain groups are underserved as well?
Absolutely. And I would underscore right after
Yeah.
healthcare and legal education. And as you know, multilingual children in early education and non native speakers in higher education face challenges due to inadequate language support. And this impact development milestones, of course, and promotes like dropout rates. It's really detrimental to society. Not to mention the fact that not only children face these barriers, but then once they speak English, then they are used as interpreters, which is a cost, I took on rather recently. So,
That's actually a really great point where we could pivot to talk about Unheard Voices. Actually, you list on the website a statistic that 11 million children are asked to work as interpreters in the U.S., and then you follow that with a very profound statement, which is that children should be free to enjoy their childhood and not burdened with the responsibilities of acting as interpreters in complex situations and adult situations, I might add. And yet, time and time again, we hear about kids being inducted to interpret for their parents. We hear about this all the time, and um, this is what drew me to your work with Unheard Voices. Is that I hear about it all the time, and it's such a big issue across the U.S. and globally, really.
yes, Dieter, thank you for bringing that up and for the opportunity to talk openly about our effort and heard voices. I'm not alone in this effort, and there are many individuals and companies that are supporting these efforts. I'm going to tell you a bit about it. As you mentioned, there are 11 million children just in the US that are acting as interpreters. And if you think about that,
Yeah,
this is child labor, right?
yeah,
That we somehow are okay with, right? And these children are being employed, unpaid, of course. They are taken out of school to go interpret for
yeah,
professionals that should know better, right? In circumstances that are life altering for usually their adult parents. So here you have children given information on critical diagnosis or information on how to purchase a house, on a loan. I mean, crazy things you would not accept
yeah,
if done to
yeah,
you in another country, right? And let me give you a case that is perhaps the most dramatic case, the case of Griselda Zamora. She was a 13-year-old girl who served as her family's interpreter because
yeah,
her parents spoke limited English. When Griselda became seriously ill and was taken to the hospital, she was too sick to interpret for herself, and the hospital did not provide an interpreter. So, this language barrier led to a critical misunderstanding. Without an interpreter, her Spanish speaking parents were instructed to bring her back immediately if her symptoms worsened, but they understood
oh my
they
gosh,
should wait three
yeah,
days to see a doctor. As a result, her condition worsened, and by the time they returned to the hospital, she had a ruptured appendix, and tragically, Griselda died after being airlifted to another medical center. So this tragedy could have
yeah,
been prevented if they had an interpreter, right? But not only they didn't have an interpreter,
yeah,
they used the sick child to do this. So Unheard Voices is trying to eliminate children, like eliminate the practice of child interpreting, and we advocate for the use of professional interpreters and translators, ensuring that language barriers don't burden children or compromise communication. So we need people's help and support, and they can help in many ways, right? So we are currently gathering stories from people like Griselda, who have experienced child interpreting firsthand, so that they can give us their experience and shed light on what they felt when they were interpreting for adults. We're also seeking donations, of course, and our website is now ready to receive donations, and we will have that enabled for the month of November, because we want to fund a powerful film, hopefully, a film project to document the impact of child interpretation. So donating to this cause, we have there is a broad range. You can
yeah.
donate 500, whatever you want. And third, if you can invite us to speak to one of your launch and learn sessions, because many companies have this kind of session. And we can talk about language access and child interpretation at that event. So there are many ways to help, at least three ways that I mentioned right now. And
Yeah. Well, I was going to say we'll put up a graphic with the website address and contact details. And I want to appeal to any of the folks out there in the language industry. If you have film production background or connections, definitely reach out. Um, Being able to contribute to this organization in terms of expertise, donations, of course, and also, um, if you have specialized skills, there's a lot of really cool folks already attached and involved with Unheard Voices, and I think it's a great cause to be involved with. So we'll put all the contact details on that. Make sure that people know how to get in touch.
thank you, Dieter. I really believe that together we can end the practice of child interpreting, right? And yes, if people support us, that would be great. Mhm.
Well, it's just you think about it. Yeah, I mean, it doesn't. When you think about it, right? A child being brought in to interpret for a parent who may have a particularly sensitive or traumatic health related issue. I mean, I can't even imagine what kind of psychological effect that may have on someone, to be interpreting this information coming from the physician or whomever, and then having to onboard that, internalize it, and also provide this professional service that it's not on. So
Right. And I also want to say that this is not about victimizing children, right? I know that many children feel very proud of helping their parents, but this is more about changing a very critical narrative. And that narrative is that they are interpreting for their parents, right? As if their parents somehow. Well, let me say this: they are not only interpreting for their parents; they are interpreting for professionals that should abide by their own code of ethics, right? And so we need to change the narrative to at least express the problem accurately, because those professionals that use children as interpreters are really forgetting their own code of ethics. I'm talking about doctors who have a mandate to communicate effectively in their code of ethics. And believe me, to create my class, I actually went into each one of the codes of ethics of doctors, nurses, pharmacists, dentists, lawyers, social workers, and every single one of them has a canon on communication and helping the community that they serve. So we can't forget that we have a community of multilingual speakers, right? So we need to change that narrative and say these children are interpreting for professionals who are not abiding by their own code of ethics.
well, and then you also always get folks that say, well, it costs so much, to support languages, and we can't support all the languages. But what do you, in your estimation, what are some of the more common misconceptions around the costs and the logistics of providing proper, comprehensive language services in the community?
Well, definitely the cost, right? But what I would say is that what's costly is to have a person in jail or deprived of freedom when they should not be, right? That's costly. What's expensive is to having medical errors based on communication, preventable medical errors, right? As I think the Agency for Healthcare Research and Quality in 2012 issued a report on how language barriers affected limited English proficient persons, and what's clear is that they have worse outcomes, of course, but they have
Yeah.
critical events or very or
Yep.
critical events, or I am forgetting the right name for that, but at a rate 4 times bigger than an English speaker, right? Adverse event, that's the word I was looking for. They experience adverse events at a rate four
Yeah.
times higher than an English speaker. So that's what's expensive. The amounts, the times they have to go back to the hospital for that when they didn't need to, right? So that's
Yeah.
what I would say. But there are other misconceptions like well, the demand is low, so language services aren't necessary.
Yeah.
Even if you have one person that in your community that don't speak English, you can discriminate against that person. There are thankfully laws that prevent that. So demand that
And it's an awareness issue too, right? People don't know that these resources are available to them, and they're not often not communicated or publicized very, you know, very carefully, and there's not a lot of community outreach to let people know about these services that exist, right?
yes, and you would love this one. I think that machine translation is an adequate substitute is another misconception.
Oh
You
yes,
need to
yep,
think about that one too. Like obviously it improves the system, right? But we have to have human involvement with machine or AI.
Carol, what are your thoughts on the rise of AI and machine translation in the use of language access? How do you see the future of human interpreters and translators to ensure that there is equitable language access out there?
Very important question, Dieter. And as AI and machine translation continue to evolve, the role of human interpreters and translators becomes even more crucial in ensuring equitable language access, especially in high stakes fields like healthcare, law, social services. And I want to quote Ji Wang from his article, Humans in the Loop. He says there is a distinct difference between automating tasks like manufacturing or driving and automating pursuits that are inherently tied to human understanding and meaning, such as interpreting and translation. That was the substitution. I think he mentioned creating music. And he said, while cost, speed, and safety might guide many automated tasks, translating and interpreting require us to value the process itself, fundamentally about human connection, empathy, and cultural exchange. So while AI brings valuable speed and scalability, it often lacks the deeper cultural sensitivity, contextual understanding, ethical nuance, etc. Right?
Yeah,
So
absolutely. It struggles.
yeah, so we have to keep humans in the loop, is what I think. Because we have to. This is perhaps the first time we have to ask about what are the values guiding AI development in language services. Right. This is what we need to pay attention to. And rather than viewing human expertise in interpreting and translation as replaceable, it is more accurate to see it as complementary to AI. That's what I think.
Yeah.
Um, so I think that human translators and interpreters can serve in a human in the loop role, overseeing and refining machine generated outputs to maintain quality, cultural context, and safety. Safety is very important because you don't want to be. So who is accountable, for example, for some machine translation that uh,
Yeah.
asks a patient to do the wrong thing, right? And for
It's
that,
exactly right.
right. So that's
Yeah.
very important.
That is a very important question, and I think if there's one thing that I have noticed is that at least in the language sector, in the language industry, this question of human in the loop, versus AI and when to use it, it is a an ongoing discussion point. There are organizations sort of rallying around. There's a Safe AI group that
Yes.
have put some, you know thought and structure around our approaches to AI use in language. The spotlight really is on in language more so than a lot of other industries, has really sort of pushed the envelope on that question, right? Like it's really uh, quite front and center in our industry, more so than a lot of other industry which out there which are just beginning to struggle with these questions, where we've rolled up our sleeves and are starting to to really figure it out and understand you know where the machine is helpful and where the human is critical. Um,
Yes. And definitely a shout out to our colleagues in AI, Mila Golova and Bill Rivers and many others. But I also want to say something about our idealization of human translation and interpreting, because I think it's also important that we understand as humans that in order for us to make a real difference, we need to master something beyond just languages, right? Or
yeah.
I often hear a lot of kind of snob comments from interpreters about and I have said them myself about what term is better and what's the perfect grammar and all that. But we need to actually go in different direction, right? Instead of measuring success by how much we actually have, how much we know about the language, we need to start measuring success by how much we actually help the person in front of us,
Outcomes.
right?
Yeah.
So
Yeah.
I think this is what really makes interpreters different, and that's what makes my company different. Is that's why it's called Equal Access Language Services, because we're beyond just interpreting and translation. And I think interpreters should see themselves as language access advocates more than just walking dictionaries. They need to understand their advocacy role.
It, absolutely, and the interpreter today is very multifaceted in terms of what they bring to the party. Right, you're a professional linguist, follows a code of ethics. You are IT powered. You're an IT worker with wherever you go these days as well. You're maybe AI and MT augmented. There are tools that you could bring to bear in these situations, and it is definitely a very complex role. And at the end of the day, the interpreter is expected to have emotional intelligence and be able to read body language and also scan the room to see how it's vibing. There's a lot of different things going on at once. So
But those
you
things that
know
you mentioned are the things that are going to have a lasting impact, that are not
yeah,
going to be replaced by AI anytime soon.
not anytime in the near future, anyways. Well, listen, we're getting close to time here, but I wanted to ask you, very directly, what, we're going to uh, put up the contact details for Unheard Voices. I'm very excited about that. I'm excited to hear more about the film. Certainly, folks that have stories and can share stories, we want to get that out there as well. But what steps could folks in the language industry and beyond, everyday citizens and advocacy groups and associations, what can they do to help push for better language access in their local communities, locally, regionally, nationally? What are some things that very practical things that they can do today?
Yes, so include language access as part of your identity, meaning the fact that you don't have to work with immigrants or a specific community to conceive yourself as an organization that needs to have language access, right? It's not required. So changing or adding that to your identity as an organization is key. So you need to educate yourself and others on language access rights, right? Understanding what is said in the Title 6, in the Executive Order 13166, in the Americans with Disabilities Act, the also the Section 1557 of the ACA. Educate yourself on that. Then you can partner with local organizations to promote language access. And it's incredible to me that I actually have more small clients than big clients. So definitely budget or size is not an issue. You can be really small. And with the help of technology, you can offer 24/7 language access. You don't need to have a huge budget to do that. I think that's very important to understand. And
Yeah,
then also engaging with local government officials, and also with the community, right? Testing the services that you provide with the community. Testing is not the right word, but like checking if the services that you provide are language accessible, and
Right.
then document and report language access violations. This is also very important, because the only way to drive effective policies is if people are willing to say, hey, you know what, this organization is not compliant, and not in a with the type of animosity that you file a claim for a car accident, for example, which, but more with the, like,
A
this needs to
feedback
be,
loop,
yeah,
some kind of a
exactly.
feedback loop. Yeah, absolutely. Well,
Hmm.
there's never enough time to dedicate to this topic, and so we're just going to have to uh, reconvene on language access again at some point. I want to thank you for joining us here today, Carol. Thank you so much. Looking forward to hearing. I see you pop up on events all over the place. So I am stalking you online with all the different things that that you are involved in, because I know wherever I see your name associated with, there is something good being done about language access and equity, justice and language rights, and very thankful for the good work that you do in that space.
Thank
And
you, Peter, and thank you, Woods Lingo, to bring me to the BoostCast.
absolutely, absolutely. Well, we'll see you at some future event, hopefully in the near future. One of these conferences, whether it's overseas or in the U.S., but we'll figure it out. And thanks again, and thanks everyone for joining us here on BoostCast. And we'll see you soon. Take care.